In this second presentation, I basically discussed the role of hematopoietic stem cell transplantation in aggressive B-cell malignancies, basically focusing on diffuse large B-cell lymphoma and mantle cell lymphoma. Basically because hematopoietic stem cell transplantation is probably a moving target for these aggressive B-cell malignancies. Unfortunately, we don't have prospective clinical trials in the new era, so our knowledge basically relies in retrospective analysis, and basically because we have new drugs and new treatment strategies that can eventually compete with hematopoietic stem cell transplantation, eventually change the patient profile that is being taken to transplant, and eventually change the toxicity of stem cell transplantation. So basically, lymphomas are the second major indication for an autologous stem cell transplant, and in spite of what I have said, the numbers are still increasing, at least in Europe. In terms of allogenic stem cell transplant, allotransplant is usually performed in those patients who relapse after an autologous stem cell transplantation, and also the numbers are increasing over time, taking the data coming from the European registry. In diffuse large B-cell lymphoma, autologous stem cell transplantation is the standard of care for those patients in first chemosensitive relapse or in second complete remission. Although we have to acknowledge that some of these patients displaying high-risk features don't do very well with an autologous stem cell transplant. Autologous transplant is able to cure around 50% of these patients with diffuse large B-cell lymphoma, and for these patients who relapse after the autologous stem cell transplant, allogenic transplantation is an option, offering around 40% progression-free survival for those patients who are able to reach the allogeneic stem cell transplantation. Mantle cell lymphoma is a significantly less frequent aggressive B-cell malignancy. Autologous stem cell transplant is also the standard of care, at least for the time being, for those patients that achieve a first complete remission or a partial remission with the use of high-dose Cytarabine and Brentuximab containing protocols. Although in Europe we have an ongoing phase 3 prospective clinical trial where the role of autologous stem cell transplant is going to be challenged by a new drug, which is Ibrutinib, that has demonstrated to be very effective in mantle cell lymphoma. And usually allogenic stem cell transplantation is dedicated to those patients who relapse after an autologous stem cell transplant, with the possibility to rescue with prolonged progression-free survival around 30% of the patients.